Other.
When you think about the hardest decision in life, what does that include? If you have ever had to make the decision for your family member or a friend on whether or not they would donate their organs, then you know exactly what I'm talking about. Ladies and gentlemen, we're here today to share with you the facts of organ donation, in the hopes that you will someday give the ultimate gift of life to someone. Organ donation is where a person donates their organs for transplant. A lot of people find organ donation a difficult topic to talk about. It reminds them that they may lose you someday. Organ donation is as dark a topic as discussing a will or talking about death. Many times, organ donation goes along with tragic loss. But for those people who are on an organ donation list, it's a blessing. These people are the recipients. Organ transplant is becoming a very popular procedure in a way to treat different conditions. Patients with kidney failure have dialysis several times a week and are able to return to a completely normal life. For patients who are waiting for a liver or a heart transplant, it's the only chance of them continuing life. The cost effectiveness of transplantation is impressive. Dialysis costs the community between $30,000 and $50,000 a year for each patient. On the other hand, a kidney transplant costs $18,000 in the first year, and then the cost of medications thereafter. Another important aspect is that the person is usually able to return to work. The need for organ donation is growing rapidly. Organs that can be donated for transplant include kidneys, heart, lungs, liver, small bowel, and pancreas. There are currently over 123,000 people waiting for life-saving organ transplants in the United States. Imagine that you are sitting in your cardiologist's office and they come in and tell you that you have a few months to live and need to be put on a donor list. You will then be put on a list and wait, hoping that there will be a donor that matches you. Could you imagine what it would be like to be handed a death sentence like that? To know that there are millions of people in the world that are capable of saving your life but choose not to. Thousands of people are added to this list daily. That means that thousands of people go through making this decision on a daily basis. In 2013, the living donor age broke down to the ages of 18 to 34 at 29%, 35 to 49 at 40%, the ages 50 to 64 at 27%, and those over 65 years old was only 2%. In 2013, living donor gender breakdown, the females outscored the males at 61%, where males only carried 38% of donation. There are nearly 3,000 new patients added to the kidney waiting list each month. That breaks down to one patient being added every 14 minutes. On average, 12 people die each year while waiting for a life-saving kidney transplant. The grim reality of these large numbers are that many of these people waiting for organs will not receive one and will die. Statistically, 21 people will die each day waiting on an organ. According to the U.S. Department of Health and Human Services, people of all ages can donate their organs. You can donate an organ up to the year of 70 years of age. One donation can save 8 lives. One eye and tissue donor can save or improve the lives of 50 people. That means an organ, eye, and tissue donor could save over 58 people. How do you think that it would feel knowing that your loved one saved 58 people during your time of grief? In 2013 alone, there were 260 one-year-old babies that received an amazing gift from someone, the gift of life. Someone you know could be in need of an organ right now. Either way, each number represents a life, a mom, a dad, a brother, a sister, or a child. Someone who is important, someone who is in need of you. There are people all over the world, especially right here in Kentucky, that need your help, or else they will die without a new organ. Virtually anyone can become a donor. Your medical condition at the time of death is what determines whether you can be a donor or not. And those donations can go to a transplant or scientific research. Signing a donor card, registering from your driver's license, both of those are good first steps to designating your wishes about organ donation. The most vital step is speaking to your loved ones, speaking to your family about whether or not you want to become an organ donor. That's because family members are normally the ones that are asked to give the consent for organ donation at your time of loss or in your time of grief. Some people are scared that if they agree to donate their organs and have to go to the hospital, that the hospital staff will not take good care of them. This is not true. When you go to the hospital for treatment, doctors focus on saving your life, not someone else's. Another myth that people may be confused about is whether or not they have an open casket funeral if they donate their organs. Organ and tissue donation doesn't interfere with having an open casket or not. When skin is donated, they take a small layer of skin that's similar to a sunburn, and it's peeled off the donor's back, which is covered with clothing. Because the donor is clothed and lying on his back in the casket, then no one will see the difference. If you haven't heard anything else, hear this. The gift of organ donation is the most amazing gift that anyone can give. After all, when you die and have no use for your organs, why should you be depriving someone else from using them?